Hello and welcome to Missouri State Health Insurance Assistance Program orientation. Today you will have the opportunity to learn more about the claim program, what we do to help people on Medicare, and also how to become a volunteer and the commitment that may involve. And after listening, we hope that you may want to join our claim team. The State Health Insurance Assistance Program, or SHIP, is a national program that offers one-on-one counseling and assistance to people with Medicare and their families. This is done through federal grants directed to the states. SHIPs provide free counseling and assistance in person and through the telephone and at local community events. In our state, our program is called CLAIM, Community Leaders Assisting the Insured of Missouri. We are a state-based program designed to meet the local needs for people on Medicare. Congress created the SHIP programs in 1990 to provide Medicare education. And the purpose of this was to help people understand their Medicare and to make informed decisions about the benefits that they have. Being a part of the SHIP program, volunteers and staff have had many opportunities to be involved with educating and helping people understand new benefits and changes in the program. In 1997, Medicare Plus Choice program was implemented. Those plans are now called Medicare Advantage. In 2004, we saw the implementation of the prescription drug discount card, followed by the implementation of Medicare Part D in 2006. Most recently, in 2010, we started talking more about the preventive benefit coverages that are available for people, and also the reduction of the coverage gap for Part D, including the annual wellness visit that has most been recently added. In 1990, Congress authorized the Department of Health and Human Services to make grants to states and territories to fund the state health insurance assistance programs. These grants are administered by the Centers for Medicare and Medicaid Services. The funds were received by the Missouri Department of Insurance in 1993, and in that same year the funds were released as a contract. Primaris bid on the contract at that time and has continued to be awarded the contract since then. Primaris is the Medicare Quality Improvement Organization for the state of Missouri and is a healthcare consulting company. As part of our mission, it is to share knowledge and improve health care.
Community partners are a vital part of our program. We are part of the nationwide State Health Insurance Assistance Program, or SHIP program, and we serve Missourians throughout the state. We do this by partnering with local organizations to provide places for volunteers to meet with beneficiaries one-on-one, to provide a place where you can have space that is private so that information can be shared, and so that you can have access to computers, telephones, faxes, internet, email, and other tools that you may need to do the work and provide the services for Medicare beneficiaries and their family members. These community partners connect the program with the community and provide an opportunity for individuals in the local community to seek the help they need from local members in the community, therefore accomplishing our goal of local people helping local people. This means that hospitals, area agencies on aging, civic organizations, public housing, faith-based programs, healthcare organizations, associations, libraries, and other places where people might gather, the senior adults of your community, become a vital link between Medicare beneficiaries and the Medicare program, with you assisting them to make the decisions they need to make. We make those decisions and help Medicare beneficiaries make those decisions by offering free, unbiased information and assistance. We also provide education to groups of Medicare beneficiaries, consumers, their caregivers, the professionals in your town, in your location, and help with local services as well, because there may be something locally offered in your community that is not offered statewide. Claim volunteers offer help for Missourians with many different programs and projects. We obviously help for Medicare and the issues related to Medicare. But we can also help fill out applications and turn the applications in for Missouri Health Net, or what used to be called Medicaid. We can help people make a decision whether or not a Medicare Advantage plan is a good fit for them, or if they would prefer original Medicare, whether a Medigap or supplemental policy would be a good place for them. During the annual open enrollment season of October 15 through December the 7th, we are always helping Medicare beneficiaries select a Part D drug plan for next year. And this season is a very, very busy time, and we will have lots of opportunities to help lots of folks. We also, as part of that work, help with the Missouri RX program, which assists beneficiaries who have limited income with their copays on their medications by paying half of that copay for those beneficiaries. Oftentimes, a beneficiary will come to us with a billing issue, saying, I thought Medicare should pay for this, or I don't understand why they didn't pay for this service, and need some help in negotiating the maze to get that figured out as to why or why it was not covered. We are always on the lookout for fraud and abuse, and we partner with one of our community partners, the Missouri SMP program, which is another statewide organization. It's the Senior Medicare Patrol. Their office is in Warrensburg, and they are the ones that if we suspect there might be fraud or abuse, we report that to them, and they help us ferret that out and determine, is there actually fraud and abuse or just a misunderstanding in the way the system works? We can also help with appeals and grievances. I don't agree with the decision that Medicare has made. I don't understand the process. Or maybe we do not feel that it was done appropriately, so we can help with an appeal or a grievance with Medicare itself. Oftentimes, we get calls from folks that say, I need some information about long-term care insurance. While Medicare does not cover long-term care, there are insurance policies available for individuals, and we can help them sort out which one would fit their needs the best. We also distribute Medicare materials for beneficiaries so that they can find information about the claim program and other processes and programs available to them in places like libraries and senior centers and drugstores and places like that. And there are always health fairs and community events going on that are a good opportunity for individuals to learn more about the program and learn more about what we do, and it's a good opportunity to meet and connect with people in the community. Those are all things that we can do to help the citizens of Missouri. One of the benefits of volunteering is the satisfaction that we get from helping others. There's not a better feeling than hanging up the phone after finishing a conversation with somebody or concluding a face-to-face meeting with someone and thinking back and saying and feeling like I made a difference for that person. In addition to that, it is challenging. This is the one thing I enjoy about this program, is that no two cases are exactly the same. And we get to be a little bit of a detective and find out what the issues are and see if we can't help individuals in solving those issues. So it is challenging and stimulating. We can help people receive benefits that they did not know that they were eligible for, or they did not realize could be something that would help them with the situation that they are dealing with. We gain personal knowledge of Medicare, which gives us an advantage as we work through our own Medicare and maybe our family members and others. We save people some money. We oftentimes find someone who is paying more for their Part D prescription drug plan or than they need to be, or paying more for medications than they need to be, or are struggling to balance the meals and the mortgage and the medications, and so we have programs available to help them and help them save some money in order to make those decisions of everyday life a little bit easier. And we recognize those contributions because it is important that all of us have not just input into, but are recognized for our efforts, and we want to say thank you for making a difference in the lives of the citizens of Missouri. When people call our call center, they call for a variety of reasons. They may be the 70-year-old widow who has just lost a spouse, and the spouse always took care of all of the Medicare and the insurance and all of the other business type of issues, and they really don't know what to do and where to turn and need assistance in figuring all of this out. Oftentimes, a 45 or 50-year-old or someone under the age of 65 who has been declared disabled by the Social Security Administration will call us and say, I'm now eligible for Medicare. I don't know what to do next. What do I need to do, and how can I get through this process? And we can help them do that. We've had daughters and sons and son-in-laws and daughter-in-laws call us and say, I'm helping to take care of mom or dad, and I don't understand the benefits that they have. Can you help me understand what they have? And yes, we can work with them. Occasionally, a social worker will call us, and they have a client that they're working with who is either sick or in a nursing home or has a situation in their life that they need some help with or assistance with. Many of us, as we approach retirement, recognize that we have not paid a whole lot of attention to Medicare and don't know exactly what it does and doesn't do. And so in 3 or 4 months, I'm getting ready to retire, and I'm not sure what it is and what decisions I need to make and what do I need to do and how do I get enrolled and all of those kinds of things. And so we get calls from those folks saying, help me navigate this so that I get all the pieces and parts and make the right decisions in place. With our economy the way it's been of late, people are losing their benefits sometimes, and people call us and say, I just lost their benefits, and I just lost benefits that I had. What options do I have? A professional caregiver will need some information about, is this particular service covered, or is this the best Part D drug plan for a person, or a person needing assistance to enroll in Part D. Will also call us and ask for that help. And sometimes we just get a general question. Will Medicare pay for my glasses after cataract surgery? How do we do all of this? How do we meet these clients' needs? First of all, volunteers are trained on the Medicare program and related assistance programs. This is a training that is 4 days long. The first 2 days will be online very, very soon, and the first 2 sections of that, and then so that you can do those as a work at your own pace. Following that, there will be 2 days of classroom time that will equip you to answer the questions that need to be handled by counselors, folks such as yourself, with the Medicare beneficiaries. Part of this allows us to relate to the questions and the needs of the people that we are assisting, because we understand Medicare. Many times our volunteers are on Medicare themselves and can relate to the types of questions that are being asked. In addition to this, volunteers have access to support staff. Each person throughout the state, each county has a regional liaison, such as myself, assigned to it. If you get stuck or have a question or do not understand, or somebody asks you a question that you don't have the answer to, you have the opportunity to help them by calling us, and if we don't know the answer, we can go to other folks and get that. But in addition to the regional liaisons, we have trainers throughout the state that we can also call. We have the office in Kansas City, the regional office in Kansas City that helps us sometimes. And we also have access to the Centers for Medicare and Medicaid Services and other professionals when it is needed, so that we can get in touch with people quickly and get answers to the questions that they need. The types of training and support that you receive starts out with orientation and initial training. Part of that orientation is what we're doing right now here on this webinar. In addition, you'll receive the training and the conference calls and the updates about the things that are happening in Medicare and the Medicare world and the changes that are being made and updates to the regulations, etc. One of the other avenues of support that you have, as I mentioned earlier, the regional liaisons and the trainers, but your community partner also can be a form of support, because maybe it's something just as simple as you need access to a computer or a fax machine to fax information to CMS or to the office here, and we are providing a variety of training and volunteer support. This orientation session that you are watching for potential volunteers was created to give you a general idea and general information about the program, describe how the program works, the commitments needed to participate in the program as a trained counselor. In initial trainings, we go over Medicare benefits, Medicare Advantage plans, Part D drug coverage, supplemental insurance benefits, and other public benefit programs like MoHealthNet, or what used to be called Medicaid. This training takes an approximately 28 hours to complete. Once initial training is completed, we ask that volunteers continue their education through regular continuing education sessions. These are 3-hour face-to-face meetings in your area and can be supplemented with attendance at conference calls. Medicare usually offers 2 one-hour calls a month, and Claim also sponsors additional calls on various subjects of interest and need to counselors. If an issue arises where a volunteer needs information about how to handle a situation, we also send out emails about how to deal with or how to work with Medicare and that particular situation, so that individuals can serve the beneficiaries of the state. We also share information about monthly educational conference calls offered by Medicare every month, and those calls available throughout the year. Along with the training materials that you will receive in training, you have the availability of your regional liaison, as I have mentioned, your trainer, and other claim staff members, including our program director, to answer your questions and offer assistance with any issues that you may encounter. You also have the support of your community partner, where you are volunteering. The commitment that we ask you to make as part of your training and part of your service to the local Medicare beneficiaries is that we ask that every volunteer make a 1-year commitment to our program. Our success depends on our volunteers. In order to make sure our volunteers have the most up-to-date information on the Medicare program, we ask that you participate in 12 hours of training annually. This can be accomplished through attendance at continuing education sessions, where you have the opportunity to network with other volunteers and the trainers to discuss information face-to-face, and the monthly educational conference calls that we have mentioned previously, offered by Medicare and through the Claim program. Along with training, a volunteer needs to practice their skills. This means that we're going to ask you to commit to a minimum of 6 hours counseling on average per month. A volunteer may not have 6 hours every month in a particular area. However, during the Medicare open enrollment period, October 15 through December 7, we have more than enough demand and more than enough need and events to go around. So a volunteer can make up for any slow months during that time frame. We also put out calls for assistance on occasion when we have an abundance of referrals in the main office. As long as a volunteer is able to make long-distance phone calls, we can provide you with the calling card and the tools to keep you busy. Just let us know if you are available. The way we track volunteers is by your contact forms and your event forms, which is part of the reporting process. Each contact you make, every time you talk to a Medicare beneficiary about Medicare and help them make a decision, each time you attend a Medicare outreach event or a claim outreach event, that contact form and that report form must be completed. The work is not done until the paperwork is done. For events that we ask you to submit an event form to either the main office or to your local regional liaison. For counseling contacts, we use the National SHIP reporting site, shiptalk.org. After training, you will be given a login and password so that you can access ShipTalk and can do the reporting of the work that you have done. This is important because it is also part of your annual certification. Certification is something that we do in order to ensure that Medicare beneficiaries are getting the best and most current information. So take credit for the work that you are doing. Help us show Medicare that we are making efforts to reach people in the state of Missouri, the Medicare beneficiaries in the state of Missouri, and to help maintain your certification process. Thank you very much. We're now going to move forward to the claim team.
Our claim team is the strength of the claim program, and we have several volunteer opportunities. Claim would not be able to help Missouri Medicare beneficiaries without every single member of the team. Counselors are the backbone of the claim program, and as a trained volunteer, you will assist Medicare beneficiaries with their Medicare-related questions, both in person or over the phone. Claim will provide an initial training consist of online training such as you are doing now, and some group interaction training. Then we will keep you updated with continuing education training, conference calls, weekly updates, but not to worry, we have mentors and resources to help you at all times. Leaders in outreach are the event gurus for claim. These volunteers promote local awareness of the claim program by participating in health fairs and civic events. The leaders in outreach know their community activities and find opportunities to promote awareness of the claim program. They may speak at a church event or a professional association, or they may man a booth at a health fair or community event. The leaders in outreach are always looking for opportunities to help Medicare beneficiaries become aware of the claim services. Administrative volunteers are the helpers. They assist local claim sponsor coordinators with the day-to-day operations. They will help with paperwork, data entry, and other projects the sponsor site coordinator assigns. Sometimes they may attend an enrollment event and help with the registration, or they may help with contact forms, tracking referrals, and various other assignments. Interest specialists are the experts. They may be that go-to counselor for a specific area such as a Veterans Administration, Medicare Advantage, or a Medigap question. These counselors have had experience handling issues with their area of interest. Mentors act as the lifeline for the new volunteer and are available to advise new counselors on counseling techniques. They will contact the new counselor after training and welcome them to the claim program and offer assistance. Mentors allow counselors to shadow them while counseling a referral so they can learn the techniques. Or they may watch a counselor and help them with their referral. Your mentor is available by phone to discuss referrals and assist with any problems. As you can see, every member of the team has a vital role in the success of claim helping Missouri Medicare beneficiaries. Claim's goal is to help individuals make informed choices, exercise their rights, and be proactive in healthcare decisions. Volunteers are trained and act in good faith. What will you do as a counselor? Well, information counselors give should not be taken as legal advice to help people, but rather help with their questions and problems regarding Medicare prescription drug programs or Part D, or find a Medicare Advantage plan. They may assist a beneficiary in gathering information to make a decision on a Medigap policy or supplemental insurance. Counselors may help with assisting a beneficiary in finding information on long-term care insurance. Counselors also help with questions regarding the appeal process. How do I enroll? You may get a question about a bill received, and you may find out about fraudulent practices and would report that to the Senior Medicare Patrol. There are a variety of issues that beneficiaries have, and they're all different. Volunteer counselors can help a client with health and drug plan searches and enrollment into a plan. Also, volunteers can help with the application process into an assistance program such as a Medicare Savings Program. Volunteers try to answer questions about Medicare, Medicaid, or supplemental insurance, and if you don't know the answer, then you're able to contact your mentor to help you answer a beneficiary's question. Volunteer counselors will assist a client in understanding and organizing healthcare bills and statements, and will help them manage their healthcare-related paperwork in the future. As a counselor, you will assist a client with submitting claims for Medicare, Medicare Advantage, or supplemental insurance. Or you may help a client understand the Medicare appeals process and assist a client in the appeal process. As a volunteer counselor, there are certain things you are not able to do for a client. You would not be able to recommend someone to buy a specific insurance policy. And as a volunteer, you cannot be connected with any insurance, financial planning, or pharmaceutical industry. A volunteer counselor cannot share any information that was discussed unless authorized to do so by the client. All contact is confidential. Volunteers do not charge for their counseling services. And as a counselor, you will not make a final decision on any matter for a client, but rather you will help them to make an informed decision. It is up to the beneficiary to make that final decision. Some of the questions you need to ask yourself before committing to volunteering with the claim program. What do you like about volunteering? Do you currently volunteer somewhere else? And if you do you really have time to commit to another volunteer program? What do you hope to get out of volunteering for our program? Do you like working with people, especially older people? And are you a good listener? Because as a claim volunteer, you must be a good listener. Do you like to problem solve? Because as a claim volunteer, there are many opportunities for your problem-solving skills to kick in. And do you feel you can ask personal health and financial questions? It is important to be able to ask a beneficiary their income so that you can see if they are eligible for some of our Medicare savings programs. Do you like using a computer and the internet? As a claim volunteer, you must be able to use a computer. Now what do? I want to join your team. The first step in joining our team is to fill out an application, and you may do so by going to MissouriClaim.org. After filling out your application, the information will be sent into the office, and then you will receive a welcome packet with additional information as to where the next training will be, what your next step will be as far as completing training online, and a regional liaison will be in touch with you. If you have additional information, you can contact Derek Sims at dsims@primaris.org, and he will be able to assist you or get you to the correct liaison or trainer that would be able to answer your questions. Let him know if you've actually submitted your volunteer application, and he can assist you in that process if you have not done so. The claim program can only succeed with the community partners and the volunteers such as yourself. So as you see, we are in need of good volunteers that are interested in helping Medicare beneficiaries. If that is your passion, please join our team.
Now that Nancy and Jim has given you information about the claim program and what it means to be a volunteer for our program, we hope that you're interested in filing an application with us. We also require all of our volunteers to have background and reference checks along with signing confidentiality and a commitment form. We have found that once people join our program after 6 months, that many of them stay with us for 3 or more years. And so we're very proud that we know that this type of work is important to the people who volunteer for us and also important to the people that they serve.
If you'd like to make an application with us, please contact us at claim@primaris.org and request an application to be sent to you, or call us at 1-800-390-3330, or visit us on our website, missouriclaim.org. We hope that you enjoyed this orientation and that you will be contacting us soon. Please do not hesitate to give us a call if you have any questions. Either myself or any of the staff would be happy to talk with you. Thank you very much.